right, all. Thanks so much for being here. We'll get the ball rolling and maybe other folks can kind of trickle in. Um, Really great talk we've got scheduled today. My name is James Nolan. I'm the Associate Director of Community Engagement at the Environmental Research and Translation for Health Center Earth, which hopefully you all are familiar with. And if not, you're going to learn a little bit more about some of the work we're doing today. And I'll be playing the dual role of both hosting and also presenting in the second part of this session. So get used to my voice. You're going to be hearing more of it today. I want to start by, of course, saying welcome everyone. I'm really glad to have you all here in this iteration of an Earthenar. This is one of many Earthenars. We've got an ongoing series that we've been hosting for the last couple of years, and many, many more hopefully to come. Earth is currently submitting a P30 renewal for another 5-year grant cycle. So this is our last year, but fingers crossed we'll be funded for at least another half decade or longer. Today's session is titled Climate Resilience in the Age of Anxiety. Our scene-setting statement. Extreme weather events have raised awareness about the impact of climate change and the effects it has on people and communities. And a growing body of research shows that climate change is affecting both physical and mental health. So how can we help people to cope? And how can healthcare professionals provide better support for their patients? We'll be hearing from two environmental and climate health and mental health presenters today, each of whom has worked over the past year or more on innovative Earth-funded projects. Our first presenter will be Jennifer Dhillon. Jennifer is the director of BounceBack Generation, a nonprofit dedicated to creating and sharing tools that build emotional resilience for youth and those who care for them. She has been a nonprofit leader working in low-income and minority communities in and around public housing since 2004. Prior to her nonprofit work, Jennifer was an environmental justice attorney and involved in several landmark actions, including closing the Hunters Point PGE and Morant Potrero Hill power plants, the West Oakland Port expansion, and Alviso Dow Corning actions. Our second presenter is an esteemed and very close colleague of mine, James Nolan. I hold the dual role as Community Engagement Manager at the Western States Pediatric Environmental Health Specialty Unit, as well as Community Engagement Associate Director at Earth. His work has focused on community engaged research and capacity building with emphasis on connecting healthcare providers to materials that are responsive to community-voiced needs. And with that, I will stop my screen share and hand the mic over to Jennifer.
Hi, everyone. Thank you so much. I'm going to pull my screen up. Thank you, James, for the introduction and the Earth Center for helping us to pilot this project. I'm going to talk about CREST, which stands for Climate Resilience and Environmental Sustainability Training. And again, this was a pilot project, and we did a lot of data gathering and feedback, and I'm going to share what we learned. It's a very small project, so it's hard to kind of extrapolate a lot of the research findings from that to a larger audience, but I'm going to show you how we're going to continue our research as we expand this program. So again, I'm Jennifer Dhillon from BounceBack Generation. As James said, we create and share tools that build, sorry, let me move this little Zoom thing. We create and share tools that build mental and emotional resilience skills for youth and those who care for them. So that's parents and teachers and everyone in between. We were founded in 2011, and it's a nice loop back because our initial work was supported by Dr. Mary Burke, who was doing some research for the PEHSU, I think is how you say it. And some of those findings we took to start our project at the Potrero Hill Terraces and Annex site. And what we really focused on was adverse childhood experiences and how we could work with peer leaders, adults in the community, to develop resilience building skills for the kids that lived in the community. So they did things like they walked kids to school. We prepared meals for the community and did social emotional learning. We did parenting classes, and we did this all with staff that came from the communities that we served. So as James said, I have a background in development studies, which is studying political economy of the developing world. And then I was an attorney, as James said, and worked on a number of cases with representing community groups. And through representing community groups, I really got involved in working with low-income communities and decided to kind of segue out of that and really answer some big questions that I had around why are some people doing better than others? And that's a very simple and kind of naive question, but it leads to a lot of thinking and understanding differently about poverty, about discrimination, about um, public housing versus regular housing, et cetera. And so, oops, wrong way. So these are just some of the pictures of some of the folks that we've worked with over the years. And one of the major things that I learned as an attorney trying to represent community groups is that when you go to a community and say, we want to help you with X, Y, or Z, they will tell you you're just kind of loading more on us. The communities that we work with are extremely stressed. They deal with toxic stress. The children have adverse childhood experiences at higher rates than kids in wealthier communities. And there's a lot of chronic stress. And so when you go to such communities and say something like, you are most at risk for suffering from the effects of climate change, the attitude is, we've got a lot already on our plate. And you're going to ask us now to do a training or to learn or to do a bunch of preparatory things or whatever it is you're asking for. And one, we don't trust you. Two, we don't have the time to deal with this. Three, you're just loading more stress upon us. And four, we didn't create the problem. And you're asking us to now deal with something that we didn't create, all of which are valid, in my opinion. So instead of saying, we're going to come in and teach you something, and because you've got to get ready and you've got to be climate resilient, we thought, why don't we address things the way that we address things when we talk about building resilience? And so what we decided to do was a pilot project. It was 8 weeks, an hour and a half each week. 12 participants, we paid them to participate. And we said, help us to create this curriculum. And what we want to do is approach first your emotional readiness, your emotional preparedness and resilience factors in your personal life. And we think those are just as important as physically preparing for a climate crisis or becoming climate resilience. Then we talked about why you should care about the environment. We put it in the perspective of their own lives, not why we think globally we should all care about the environment. So we made it very personal to what they were experiencing, how you can be prepared, how your preparation will help you feel emotionally better first, not just that you're going to go and get ready for for the climate change, or we focused a lot on potential climate crises or climate emergencies that could happen to them. And if you get emotionally ready, we said you're going to also be climate ready. You're going to be climate resilient once you become emotionally resilient. So how do we do that? We did that using a tool that we use with our communities already, which is, we call this our 6 building blocks for resilience or 6 building blocks for life. And there are these very simple 6 steps, but each one of these is neurobiologically significant and have been shown to help individuals and children, adults and children, to build resilience in their lives and to become protective of chronic stress, toxic stress, and even trauma. So they are protection, relationships, coping skills, confidence, belonging, and storytelling. So protection is important from an emotional perspective because you need protection in order to feel safe, in order to process trauma, in order to not be further traumatized or further stressed. From a climate resilience perspective, which we put in green because of course that's our agreed upon color for climate, is that when you are thinking about your emotional safety and protection, it leads you to think about, well, now how can I stay safe in a climate emergency? What can I do to plan or prepare? Can I get a go bag ready? What are the apps I can download on our phone? Relationships. You need at least one relationship you can count on to help you with your emotional life. That led us to talking about, do you have a case of emergency person? Maybe someone who's outside the area that may not be affected by what you're experiencing, someone you can call and go crash on their couch if necessary, right? Coping skills. What we teach about coping skills is coping skills are personal, and what you want to do is find some coping skills that work for your emotional life that make you feel great today, but make you feel even better tomorrow. That's how you know it's a good coping skill that works for you. And in terms of climate, you want to be, and anxiety that comes with climate, or if you're recovering from a climate event, what are 2 or 3 things that will help you get back on your feet and engage with life? And one of the examples we used was a gentleman who had gone through the Paradise Fire and had suffered from depression afterwards for many, many months. And then remembered, I used to feel a lot better when I'd go fishing. And he started to go fishing again and reported back that that helped him to get over his depression. Then we have confidence. Confidence is about trying and practicing and getting good at something, not giving up, building up those skills. And that led us to talking about what kinds of skills do you have that you could contribute to your community if there is, let's say, a heat wave that lasts for 2 weeks. What are some of the things you do? Do you know some nursing skills? Are you the person who loves to go to Costco and get everything stacked up in your garage so that you always have water for everybody? That brought us to belonging. Belonging is a deep human need. We can't survive without each other. So finding groups, maybe it's your neighborhood group, maybe it's your church group, where your family, your clan, where do you belong? And then how can you use that group to plan around what could happen in terms of an emergency? And then finally is storytelling. Storytelling is really important to describe what happened to me, to be able to talk things out. It's also how we share wisdom. It's how we ask for help. And we use that skill building and thinking about to talk about advocacy. How can you raise your voice, speak truth to power, etc. So those are the building blocks, and that's mostly what we taught. Our research was really about, we said, we're not testing you guys, we're testing us. You guys are actually testing us. You're going to give us feedback to make sure that the way we're doing this process makes sense for you. Are methods good? The way that we're teaching things, the way that we're providing information, do you like how we're presenting things? And do you enjoy the class, basically? And then we said, from an information perspective, is the information we're giving you really addressing your concerns? Is it answering questions about the climate and what matters and what doesn't matter? And then finally, are the tools, mostly those building blocks, are they providing useful tools for your own emotional development, as well as how you might prepare for climate crisis or long-term climate events? And basically what they told us is they did enjoy the teaching. They did not like that it was synchronous. They asked that in the future we provide them online and preferably on mobile devices, because a lot of people do not have access to computers, but almost everybody has a cell phone. The information, they really enjoyed that we did a lot of videoing and storytelling and a lot of discussions, and used very simple ways to talk about the complexities of climate science in a way, and giving them just the information that they needed around climate science. And they were really, really into sustainability, which was surprising to us, but we did some videos about little things they could do to kind of live more sustainably. And then finally, they told us that they really appreciated the building blocks. That was something that people don't normally come in and teach or provide information in a way that is trauma informed, which is basically what the building blocks do. And that they left the course feeling like they had more coping skills for life in general. And then that made them, that kind of freed up bandwidth to think about and care about the environment and how it might affect them. So we have a research paper that we created, or we wrote. So if you would like to download that, you can look at the actual data and get a bigger sense of what we did, and also the curriculum. And then our next step is to create mobile online mini courses. And here is a sample of what one of those mini courses would look or feel like. And that's our next step. And in those mini courses, we have the opportunity to do a lot of polling and quizzes and feedback. So we'll be able to continue to get information in and continue research into all kinds of areas around preparation, emotional resilience skills, all of that as we go forward. So any questions? Sorry, I hope I didn't go through that too fast, but I want to be mindful of time.
Hi, I have a question. My name is Sky, and I'm based in Washington D.C. and I work for Human Rights Watch. I've seen quite a few other, I don't know, gray literature, I think mostly, but maybe also some academic studies talking about the importance of activism and feeling like you're part of the solution. Um, and I was wondering if you could speak to that as well. I was totally unsurprised when you said that people were interested in sustainability. That feels I am too, for you know uh, to help myself and my family, as well as be part of, like, hopefully moving towards a more sustainable future for my kids and for the for everyone's kids. Can you talk a little bit about where climate activism, advocacy, those kinds of things fit in with everything else you've said? Thank you.
Yes, no, that's a really good question. That was one of the biggest, asks at the end of the course was we want to be advocates. We don't know how. You need to give us really good step by step, easy to understand and to follow information and instructions on where our voice could be heard the loudest. And so that's definitely something that we would create a module about how to do that. And what we did talk about was, if you like going on social media, if you're good on social media, that's your platform. If you're really good at going and, going to marches, that's your platform. And so what can we do to explore those different tools that you have, but also to how to get on the lists of when people are making decisions, when they have public comment periods, how to get on the EPA lists of things that are coming out so you know what's happening and you can comment on it. And then really understanding what's the difference between going to a public hearing where three people from your neighborhood show up, you're going to be a very loud voice versus, going to a website or sending something to your congressperson where you may not be as well heard. And really understanding where your big impacts are. And we did talk a lot about the Chevron power plant in Richmond and how some of those some policy changes were able to be created by public voices standing up in that community. And we showed some videos of some people doing that. But we have to give people more guidance, bottom line.
It looks like we got a question in the chat from Aaron Reben. Can you tell us the story of one example community you've worked with?
In as an attorney or as bounce back generation, like in the climate sense, or let me just read the question.
Project that you've just been describing, not as with your work as an attorney, but with this more recent work that you've been doing.
Yes. So I'll tell you about the Potrero Hill, which is where we started. We used to be called Healthy Generations Project. So there's a public housing site in Potrero Hill in San Francisco, which is in the process of being torn down and rebuilt by a public developer. It's going to be, they will keep the public housing units and they will add another 600 units of moderate and market rate housing. So the community is entirely changing. So what the developer was the one who hired me originally and said, can you go in and just do something for the kids, right? And at that time, Dr. Nadine Burke-Harris was developing her ACEs approach, which if your adverse childhood experiences, for those who don't know, has been studied as you can take a through line to a kid who has experienced abuse, neglect, household dysfunction, and neighborhood dysfunction, and you can draw a line to future health, mental health, and physical health problems, as well as education problems, etc. Stress changes the way that a child approaches life. It actually changes the architecture of their brain. So what can we do in order to stopgap that? So we hired folks from the community, parents and grandparents, and we said, what are the things you could do in terms of those building blocks? How can you keep the kids safe? Where we can walk them to school, right? What can you do to build relationships? Some of those kids did not have someone taking care of them after school. So the peer leaders themselves became a place where they could go to. We had a unit in the public housing site. the peers were there. They cooked lunch for them, cooked dinner for them, did social emotional learning skills, although they were just fun activities for the kids. They read to the kids. Each one of those building blocks was covered by a person in the community who cared. And so that's one example. And we're working now in different communities, which I could talk longer about, but I don't know if we have time. But you can find out more about us. Our website is bouncebackgeneration.org. And then we have a media site, which is resilience building media that is mostly made by peer youth content creators. So we serve youth between the ages of 16 and 24. And they create content. It's a website called bbgtv.org. And we do everything from podcasts to mini documentaries and short videos and social media and YouTube channel, etc.
Awesome. We're actually doing really good on time. If there's another question, feel free to ask that, and then we'll get moving on to part 2. Anybody else have any other questions or comments? I see there's some great resources folks have shared in the chat, so make sure to check those out at your leisure. Any other questions for Jennifer?
I'll just go up to, if anyone would like to read the report, you can scan here. And then if you would like to take a sample course. So we also do this for our young people. We do a lot of mini courses. So we have mini courses on relationships and how to stop anger and controlling your nervous system and, all kinds of different topics, shame, getting over shame. So we're using basically the same platform for the future CREST mini courses.
These slides are going to be sent out to all of us. Is that correct?
Will they, James?
Yeah, we'd be happy to, as long as that's okay with you, Jennifer.
Yeah, no, absolutely.
Yeah, and I will say the final report is one of the most beautiful and thorough reports I've seen for this genre of project. So definitely do check that out. Really encourage it. It was a pleasure to get to read that.
The only thing that's not included in this one, James, is all the focus group comments, but I can send those to people if they're interested. There's just a lot of really great, insightful comments from the focus group. It was just a lot to kind of dump in there, but.
Any final questions from folks? Otherwise, we can get transitioned over to part 2. Don't be shy. We're all friends here. Okay, well, we'll make sure to show out the slides. And then if you don't mind, maybe we can show out your email too, Jennifer. Is that okay?
Oh, yeah, for sure.
Awesome. Yeah, definitely encourage folks to reach out. It's a really awesome program that's got some really great future ahead of it, in addition to its really great achievements to date. As I mentioned earlier, I am James Nolan, Associate Director of Community Engagement at the Western States Pediatric Environmental Health Specialty Unit, and also dual role at the EARTH Center, the Environmental Research Translation for Health Center. Hopefully my screen share is working. It was being a little finicky last time.
Looks great.
Okay, awesome. Thank you for confirming. We get funding from all kinds of different folks, and I really, want to start by acknowledging that the American Academy of Pediatrics is really great in funding the PEHSU side of the work that I do, as well as the CDC, ATSDR, Centers for Disease Registry, and Agency for Toxic Substance Disease Registry. And this particular project that'll be a big highlight, the prescriptions prevention that I'm going to get into, also received joint support and funding from EARTH through its awesome P30, which is the NIEHF funded program. And there's a couple other folks that have contributed to this work as well. And I always want to have that as one of my first slides. I'm going to talk a little bit about the what and why of climate and environmental health, but just looking at the attendees, I feel like a lot of folks are already on the same page with that. And then kind of unveil some of our healthcare worker facing resources, mainly the Pediatric Environmental Health Toolkit, as well as some patient facing resources, prescriptions for prevention. So I want to start with the unique vulnerability of children. Again, I feel like lots of folks here on this call are already up to speed, but one of the main kind of sources of extra vulnerability for children are their behaviors and preferences that can increase exposure. So thinking about lots of hand-to-mouth behaviors as sources of like all kinds of different contamination, right? All the dust that can get on chew toys and pacifiers that can subsequently get into children's bodies. But also their preferences, right? If you've ever had a kid or been around a kid, which, hopefully is most of us, if not all of us, you can see that they don't like the peas and carrots, they do like their applesauce, or it's always something, right? And that can kind of change behaviors over time, such that you're getting heightened exposures from a specific source. That's that food of preference for that specific kid, and that can be an issue as it accumulates in the body. Differences in physiology, right, such as metabolism and excretion. Children eat more and drink more per unit of body mass than fully grown adults, so they have another kind of layer there, and also the unique window of developmental vulnerability. They have differential susceptibility, and also the longer term lifespan, right? Thinking about how exposures now can affect entire trajectories of lifetime development for kids, especially. This is one of my kind of favorite go-to graphics to put in almost every slideshow I do, because it centers, climate change and human health specifically, but also kind of helps unwrap the all kinds of different issues that constellate to form the bigger picture of not only the present impacts on human health, but also thinking about those long-term impacts and how those might constellate to disproportionately impact low-income communities of color, right? Especially thinking on the top right, looking at the degraded living conditions and social inequities that already exist, the environmental injustices that already exist, the structural racism that already exists, and how that's going to be further compounded by all these additional challenges presented by climate change. So the good news is that children's environmental health, I think in a lot of ways propelled by climate change is in the news. And the bad news is that children's environmental health is in the news. The reason it's in the news is because there's increasing frequency and severity of diseases, while simultaneously increasing awareness overall in the general population of a bunch of different really key, vital, important topics. Thinking about things like wildfire, especially, that used to be, fairly common as a born and raised Californian, that are increasingly severe and frequent. Now being also experienced in New York, places that didn't used to, as frequently or as severely have to deal with those kinds of challenges, as well as in, Maui, Hawaii, right? And thinking about all the other kinds of challenges as well, flooding, disasters from exploding train derailments, et cetera, and so on and so forth. So the PEHSU's role, the Pediatric Environmental Health Specialty Unit, there's one in each federal region, so there's 10 total, is to take calls from healthcare professionals faced with some of these challenges, right? For example, if they don't know the proper course of treatment for a heightened lead exposure, or if they're not sure how to guide a patient in protecting themselves from wildfire smoke, they can call in or email us. We take professional consults from folks. But what we realized, over the course of the 20-year history or more of the Pediatric Environmental Health Specialty Units, is that there's so much need. We needed to make sure that we had materials ahead of time. We needed to have more cohesion in those materials, like one-stop shop for a whole array of different topics. We needed to have these materials ready to go prior to the event, right? Heading off the challenge of the pass. And that we also need to integrate these key materials into the everyday common practice. So we've been working a lot, especially at the PEHSU and also at Earth, to train that next generation of healthcare practitioners, medical students, pharmacy students, nursing students, to make sure that they have the tools in their toolkit to address these challenges in real time. One of these resources that we developed is the Pediatric Environmental Health Toolkit. This is designed specifically for healthcare professionals. It's a little bit higher in its technical aspects, a little bit more in depth than what a lot of folks might be used to in the kind of general public, but very, very useful for getting medical folks up to speed. And I really want to emphasize here, it's endorsed by Physicians for Social Responsibility. And I see some of our esteemed colleagues from PSR are on this call too. So big shout out to them. This is a national effort. So we got input from all kinds of folks across the whole country, medical practitioners, but also healthcare professionals, researchers, nurses, so on and so forth. There's 37 content sections on 18 different hazards and 11 sources, as well as 7 key concepts and anticipatory guidance, right? Anticipatory guidance being specific actions or things that we caution patients to look out for based on age, different age brackets, depending on the exposure. Really quick, I want to highlight that we have 14 different content section authors across 5 different PEHSUs nationally, and 10 PEHSUs were represented across 18 peer reviewers for these materials. So they're very well vetted, lots of different experts in the field have contributed to them. Again, key support from Physicians for Social Responsibility, who helped support the original Pediatric Environmental Health Toolkit, I think almost 20 years ago now, like 18 years ago, and have also been great supporters ever since in subsequent editions. So this most recent version has, evolved all the way from back in the day when it was a print paper version to a physical digital, to a non-physical digital interface that's also mobile optimized, so that if doctors are in a rush, they can look for that material on their phone. And we're working on additional ways to get it to folks via trainings, grand rounds, lectures, and courses. So here's these main topics in the Pediatric Environmental Health Toolkit. Again, looking at environmental hazards, sources, what kinds of routes of exposure might be of concern, key concepts and anticipatory guidance. Here's what some of those key concepts look like. Climate change, of course, being at the forefront for what we're talking about today, but also making sure that we're emphasizing environmental justice, which of course is intertwined, but also has its own, separate path that it follows. Climate and the chemical environments, the built environments, exposure pathways, and then the unique vulnerabilities of pregnancy are some of the key concepts there. And I wanted to point out that this tool, again, is kind of designed to head off at the pass some of the concerns and make sure that physicians, healthcare workers in real time can access key information that's written by and vetted by healthcare professionals to address concerns that oftentimes spike with these new media features on key challenges of our times. And one of the big ones, this is just from, I think, a couple hours ago in the New York Times, is lead-tainted applesauce. And the headline is "Lead-tainted applesauce sailed through the gaps in food safety system," right? And I guarantee you there's going to be a big spike in people that are rightfully concerned about this challenge. And fortunately, we've got a Pediatric Environmental Health Toolkit section specifically dedicated to baby food, how you can reduce exposure to contaminants, anticipatory guidance based on age, exactly for that challenge. And we're working even more to think about how we can head these things off at the pass, even before the challenge, by giving kind of one-page pitches to media specialists. Another really big one right now, of course, is gas stoves, right? Thinking about how gas stoves can be a source of emissions within the home that can have disproportionate impacts, especially on children. Right here, we've got this particles and nitrogen oxide Pediatric Environmental Health Toolkit section specifically dedicated to that. That includes a special section on gas stove use and how to reduce exposures. And one final thing for those folks in the meeting that are healthcare professionals, anticipatory guidance is designed to supplement with Bright Future. So it's already in alignment with the kind of best practice protocol, which is really nice to give it a little extra bit of teeth, as it were, if you want to push to have it rolled out in your healthcare facility. Companion resource, which is perhaps even more useful to a broader swath of folks, is this prescription for prevention theory. And hopefully, if you're quick on the draw, you can scan the QR code, but I'll share out the link in the chat too when we get to the questions portion of today's talk. But really, really great program, free, online, available in English and Spanish. These are based off of the Pediatric Environmental Health Toolkit, but far more to the point, 3 to 4 sentence maximum overview, really clear do's, really clear don'ts, with emphasis on low cost or no cost solutions, and as many national level resources as we can possibly find. But also we leave space at the bottom of each of these specifically to add regional or citywide resources that might be available to that specific person, that specific patient, and that specific community. And we'll be working on rolling those out in the Bay Area with like specific resources, for example, in Richmond or Baby Hunters Point, and so on and so forth, to correspond with the CalEnviro screen ratings for kind of top exposures in those communities. Just like the PEHT, they cover 30 key topics, and we're going to roll out a couple more to make it all the way up to that 37 total that the PEHT has. And really great resource, English and Spanish. Of course, we have one on climate change, and you can kind of see a little sneak peek into what these look like, trying to make sure that the language is really accessible, to the point, clear, concise, but also vetted. by our healthcare professionals and researchers. And then going down, on the left, like really simple, clear do's you can do, preparing a go bag, for example, looking at air quality and how you can find air quality data that's legitimate, vetted, reliable in your community. And of course, a bunch of things that you should avoid doing, like opening windows on high pollution days, leaving children alone in cars, especially when it's hot outside, but always a bad idea no matter what. Also, one on natural disasters. More broadly, thinking about, again, that go bag, different kind of resources you can find that are, vetted for reliable information, thinking about evacuation plans, all that kind of stuff, as well as, the proper use of things like generators, for example. Sometimes folks forget that if you're using a gas-powered generator, you need to make sure it's outside, not just like in a porch that has open doors and windows. It needs to be completely outside, ideally a certain distance away from your home. You're not just getting that gas that's being burnt off by the fuel right back in your home that you're then breathing, so on and so forth. And then, of course, we've got some that are more about the larger scale prevention too. Like, one, what can you do to protect yourself from outdoor air pollution? But two, how can you reduce your contribution to outdoor air pollution in the first place? And just like in the other scenarios, thinking about those, clear, actionable do's and don'ts. In this case, right, one of the big ones is wearing an N95 mask when the air quality is unhealthy, especially if you can get an OSHA certified one. Creating an indoor airspace, which are also all live links. So you can go directly to another website that has more information on those specific recommendations, which is really awesome. And then another one I want to highlight in the context of this work is plastics, increasingly of concern to individual health, right? As you eat foods that are within plastic containers, especially here, we're recommending against things like microwaving food in plastic. But also in the bigger context of climate change, there's increasing evidence to support this interrelationship between plastic industries, oil industries, and potential contributions to climate change and global warming. 3 of these prescriptions for prevention have animated public service announcements that we made. I really recommend you check those out. They're fun, they're short, like a minute and a half, also available in English and Spanish. Our own internal team did the animations on these, and the script writing and the storyboarding, and the voicing. So you can hear some of us narrate some of these things, and there's like, fun little soundtracks and things. Those have been great to share it with folks. These are also available in English and Spanish. So depending on, who your kind of target population is, you can share a language that's most appropriate for that group. And they're just a small slice of the many different animations that we're going to be rolling out over this next year. And then EMS integration is a whole nother level of work that we've been doing. So electronic medical systems. This concept, for a project was really initiated by my colleague at Earth, Dr. Maria Zlatnik, who has worked a lot in OBGYN, a lot with pregnant people and with birthing. And increasingly was finding that more and more patients were requesting information about the direct impacts of climate change on pregnancy, things that they can do during pregnancy to better protect their child, and the things they can do in those very early years. So she kind of initiated this momentum to think about how we could create fact sheets specifically tailored towards those medical context needs, and then get them uploaded into the electronic medical system that your clinicians are using in the clinic. So when your doctor's on that computer and they're looking up key terms as you tell them about your symptoms, your concerns, these kinds of materials will then be queued up on the right side, or on the side of their screen, as kind of top recommended materials that are most relevant to that patient's need. So one of the first things we piloted in that process is doing a full 5-page fact sheet specifically on climate change and pregnancy, spearheaded by Dr. Maria Zlatnik, but also with lots of input from other folks on our teams. And then we essentially present that to a committee, the Patient Education Committee at UCSF, which is constituted by a bunch of different specialists from different disciplines. We then review, give feedback. We make those changes, get final approval, and then on a quarterly basis, those get uploaded into the electronic medical system that UCSF uses. And kind of with our success in that context, we started getting every single one of the prescriptions for prevention also reviewed and approved by that same committee to be uploaded. And so far, we've gotten 24 prescriptions for prevention all the way through that process and approved. And in March, we will get through our 30th. Hopefully, we've had great success so far. which means that all of the prescriptions for prevention will be in that kiosk, in that digital interface that your doctor is using. They can be reviewed by your doctor with you in the clinic, but they can also be added to aftercare summaries, and so on and so forth. And kind of in the bigger spectrum of the work, we really want to think about how we can get even more place-based, thinking about specific patients coming from specific communities impacted by specific environmental injustices could perhaps automatically be linked with the prescriptions for prevention that are most pertinent to their exact exposures that they have a heightened risk of being exposed to because of environmental injustices. So a really exciting program. UCSF's patient interface, I think, serves something around like 1 million outpatient clinic visits per year, and it's just the start. We're working to think about other electronic medical system integration opportunities too. So we're talking to Stanford and UCLA folks as we speak. Here's a little sneak peek of what that climate change and pregnancy fact sheet looks like. But again, this is a 5-pager, so it's really robust. This is just a tiny little slice of that. And yeah, I think I'll leave this slide as the last slide. It's got a QR for the Western States PEHSU's main page. Twitter, Facebook, we just started. We need followers. It's new territory for us. We also just started an Instagram too, and then there's our YouTube as well. And we can kind of go to questions. Maybe I'll leave that one up for a minute while I take questions and comments and so on and so forth. I see there's a bunch of things in the chat.
Most of it's me, James, but we do have a question. And I think it's instructed to you could, although perhaps even our audience, the question is, where can low-income residents or public schools get free or sort of free testing of their water if they suspect lead or other contaminants or other testing availabilities?
It depends. Yeah, 100% depends on the city or county. Oftentimes it'll be out of the public health department, but there are sometimes national level resources as well. It really depends on the exact exposure and where a person lives. But I wish I could say there's a one-stop shop easy answer. I don't, off the top of my head, know of any one single consolidated national level resource that anybody can access. I wish that was the case, though.
Any other questions? Feel free to put them in the chat or unmute yourself. Apologies, my video is not working today, so you can't see me, but I welcome any of you to share yours if you wanted to ask a question of James or Jennifer.
I have a comment, James, of just what I've observed doing this work in the community. And I think just generally that there's so much great information, and you guys have done such a good job of categorizing, and I love the short videos. And I think the next step for everyone is how do you now get this information in front of the communities that need it the most, the individuals that need it the most. And we have we live in an attention economy. We're constantly trying to vie for attention on different things. And I think one of the things that we have to get better at, and that's something that we're working on, and obviously you are as well, is how do we cut through all of the noise to put this information in the most interesting, entertaining, attractive, position in front of people who really are looking for this information but don't know where to go, or they find stuff that doesn't fit what they need in order to have it short and sweet and to the point and just give me exactly what I want and need. And that's something where maybe AI could be helpful. And again, the short videos that you did. But I think that's really something that I think a lot about, is how do we get this information out?
Absolutely. Yeah, I could not agree more. Right. And that's something we realized as a center just, a couple of months ago. We're like, we're not going to make new stuff as much as possible for like the next year. Right. It's exactly what you're saying, Jennifer. Like, how can you get those things to the right people, framed in the right way, in a way that, fits their busy schedules? And yeah, exactly to that point. Yeah, hopefully AI can help fill that gap. But at the same time, I think some of us are seeing with social media, where you used to be able to kind of get a better read of what kind of audiences you're reaching, that analytics are getting narrower and narrower and hidden behind paywalls. gradually in a way that's a little bit discouraging to see, to say the least. Yeah, hopefully everybody will join us in this effort, right, to think about how we can get more strategic about our outreach engagement efforts.
Well, I think we have to go back to the old-fashioned people, going out in the community and having flyers and going to events and things like that, which it's costs money, but it's worth it to have that kind of connection. Just like, as we see politicians go out there and what do? They hire a bunch of people to go knock on doors.
Yes, totally.
Alrighty, I think I'll just, as if we're not all inundated with information, but I did also want to just shout out, we have Robin Cooper, Dr. Robin Cooper here with us as well, and she works with Climate Psychiatry Alliance and also was the recipient of our Mentored Clinician Award from Earth a few years back, and produced great materials on climate anxiety, particularly related to heat and stress. And so it's still pretty cold around the nation, but as we approach summer too, there's a variety of resources there as well. And I'll drop that link in the chat. It's also on our website. I'll just give it another second for a closing question. Otherwise, I'd like to thank well, let me give it a second. Anything else?
I really appreciate your mentioning the toolkit that we did on surviving heat. Thanks a lot for that shout out. But I'm just blown away, James, by how incredible the material is that you've just shown us. And I'm going to dig down and roll up my sleeves and look at it more fully. But I do think, again, that getting it out and used is such a challenge. And I'm wondering if you can comment if you've had feedback from clinicians who are beginning to use your material. Is this working in the clinical setting, or is it just another thing for them to pay attention to? And then also, if you could comment on any information you have about the post appointments where this might be sent out to patients. I'd like to know more about that.
Yeah, absolutely. Yeah, we're just getting started. So we're still working on getting all of them integrated into the electronic medical system. I think, the last section will be in March, and it's quarterly uploads. So April, May, June will be when the full set will be available through the EMS. And that's exactly when we start doing trainings and things like that, to start kind of seeing how is this rolling out like in the clinic. Because it's one thing to have a piece of information available. It's another thing for it to be used, and it's another thing for it to be used effectively, right? Those are completely different potentially hurdles to get through. So I'll have to get back to you on how that's rolling out, but we're fingers crossed, at least some folks will start adopting them in their practice organically. And then we'll be doing trainings, things like grand rounds. Another kind of effort that Earth is really doubling down on is having environmental health courses in the medical school that overview these kinds of materials and addition materials. So we've got this really great mini immersion program that's required for first year medical students that we've been teaching. And we've been in conversation with Gina Solomon over at the Occupational Environmental and Climate Medicine to do like a even more in-depth 10-week long environmental health climate change elective, which would be a really good start, kind of get them before they're practitioners yet, like while they're still students and, still have hope and energy, is kind of the primary approach. But hopefully also, through the National PEHSU Network, I suspect we'll get a bunch of traction with folks too. But still TBD, it's so much of an effort just to make these things in the first place. That's exactly the kind of question we have now. It's like, what do we do with it? And then kind of in tandem, we've got this, series of social media posts that we're going to be rolling out that is like one post for every single one of those 30 prescriptions for prevention, which will also translate into Spanish. We're trying to get, fingers crossed, some funding to do like targeted ads. It's another angle we're thinking about, to be like, we want to target, 18 to 20-year-old people in East Los Angeles living next to a freeway with the outdoor air pollution prescription. But we'll see if we get the money to do that or not. That's always a tough ask from some of those folks. But I'll keep you posted.
We have two more questions from Alice and Bob. So the first one is, Well, and Alice, you were on. Did you want to voice it? I'm not sure if it's different than the one you have in the chat, but.
Yeah, thanks so much. I was just wondering, this has all been great information, and sorry I came in late, but I'm wondering if you are working with any partners. I'm a practitioner, I'm an architect, a green building sustainability professional and architect. So I'm wondering if you're working with any partners to actually address some of the source control, right? From either building materials or in our built environment or other exposures that have to do with built environment. Because maybe that's a discussion that we should have. I'm literally interested not only in disseminating information and having practitioners, certainly health professionals and other folks that are in youth education, for example, right, that can actually help to modify behaviors or look to put in best practices to limit exposures. But I'm actually at the source end, right? I just want to eliminate them. And it's interesting that I'm just now going onto your fantastic website on your tool and looking at and noting some gaps and wondering if there's opportunity where we could look at actually implementation of source control and mitigation.
I feel like someone must have paid you to ask that question because it's perfect. We are right now accepting applications for a program called Reach the Decision Makers, and I'll put it in the chat, that takes clinicians, pairs them with community environmental justice groups, and also environmental researchers. It's a year of mentorship and training, and then they physically go to Sacramento, meet with those policymakers, and advocate for changes exactly like what you're talking about. So that's perfect. And that's a new direction that we will actively be pursuing as like one of our core aims of our community engagement core at the Earth Center, which previously, oftentimes a lot of grants, they didn't want you to be talking to policymakers. That wasn't a priority, or sometimes depending on the funding mechanism, they actually ask that you don't do that, or sometimes there's, confusion about lobbying versus educating. But yeah, I just put in the chat our Reach the Decision Makers program. I encourage you all to apply. You also get a stipend for participating. It's a small, humble stipend, $500. But we will pay for your travel to and accommodations at Sacramento to meet with those policymakers. So that would be one potential angle. But yeah, let's follow up to think about other ideas too. It's always lots of promise, I think, with regards to the interventions on a community level.
I'd love to hear for the second question. So I don't want to take up more of your time. Thank you.
Sure, Dr. Gould.
Well, hi. Thanks to everyone for terrific presentations. I just had put a question in the chat, James, just in terms of the really terrific presentation on the pediatric toolkit and the other materials, was whether this has been shared with the Medical Society Consortium on Climate and Health, which of course focuses on climate, but there's so many overlapping issues there. So just a question on that distribution and connection making.
No, it has not, and that is an excellent lead that I will put on the top of my list to pursue. Yeah, that sounds like a perfect alignment kind of thing.
Yeah, because the toolkit was such a fundamental basis for the engagement we had within PRE with the OBGYN community, and thence the consolidation at Medical Society, et cetera. So great. Okay, thanks again.
Yeah, thank you. That's a really good lead. Yeah, we've got a whole like dissemination Excel list, and I'll put that towards the top of it. I feel like there's lots of opportunities, as we kind of catch our breath from making the darn thing to actually roll it out, and then to think about how we can get, ideally to Alice's point, upstream too, to actually prevent exposures in tandem, at a societal level at the same time as on an individual level.
Alrighty, well, thank you, everyone. I'd first like to thank Jennifer and James for sharing this amazing information, fantastic resources. Thank you, all of you, for joining us as well. I know there is lots of requests for this one for slides and links and all that stuff. I will be sure to collect it from our presenters and post it to the Earth website by end of day Thursday. I'll also put links in an upcoming mailing list, but we do try to be strategic about how much we mail. So I don't want to do it separately. And unfortunately, there's no good way for me to capture emails of everyone here. So always feel free to email me too. If you don't have the direct one, you can also do earth@ucsf.edu. So thank you all. Have a great rest of your week.